this is for Mr. Ramkrishna, where it said, is there any publication, this is from Evarista Umbatsumbu, is there any publication research done to support social distancing and wearing of masks as preventative measures for both COVID-19 and new variant COVID-20 in your knowledge? If you are aware, was it done in a sample? How many people in the sample, which region, the period of time, and what were the results obtained? And that's for Mr. Ramkrishna, who spoke on policies and regulations. Is he there?
Hi, can I come in?
Yes, please.
Yeah, thanks. To my knowledge, yeah, there's a fair amount of information available, studies done and so on. But I would just focus on the one category of evidence that comes from the lab studies of respiratory droplets conducted when researchers looked at how droplets are spread during speaking and shouting and so on. And they found that while people talk, they dispel a considerable amount of droplets that potentially could spread infectious diseases. I think there's lots of other evidence that comes from practical examples. For example, where a person was on a flight and he wore a mask and other people around him did not get infected. Others are in work settings where a person was infected, since others were using masks but not infected. So there's quite a bit of research studies available. Unfortunately, at the moment, I cannot draw on a single piece of research that I can refer to at the moment, but I can share it with you later on, unless my colleagues on the panel can also come in with specific evidence. Thank you.
Okay, so if there is further evidence, it would be great if it could be sent to the NSTF, as we are writing a media release, an article on this conference, where we'll be able to, on this discussion forum, where we'll be able to draw everything together. And then, Mr. Ramkrishna, just while we've got you on speaking there, so I wanted to know, you spoke about the legal framework that exists in the country, both nationally, kind of within the within SADC region, and looked also at the global legal framework. What has been the issue regarding actual implementation, as well as has collaboration actually happened? So while the framework exists and it looks great, what have the challenges been, and have collaboration and coordination and implementation happened? Over to you.
Okay, thank you. That's an interesting question as well. And I think Dr. Pillay mentioned it in his presentation as well. The participation of other stakeholders, for example, in the COVID response, as a practical example, I think there's much room for improvement in terms of collaboration. As I mentioned in my presentation, that there's quite a number of policies and so on that's available at the different levels, but the challenge remains that the implementation challenge remains. And I think from a practical perspective and from experience, it seems that we all know that our organizations often work in silos. And by doing so, we have placed ourselves with our own priorities. And as long as we work in silos, we'll have sort of personal priorities according to our organizations we represent. And therefore, we need to collaborate, we need to integrate our activities, and especially going forward. I think in my slides, I emphasized as well that in terms of outbreak response and epidemic preparedness, the relevant sectors have to come together. That is the human health, animal health, the environmental sectors, the researchers, and so on. We need to collaborate. We need to share information. And this information sharing, as we've experienced in the COVID outbreak response, is not only nationally, it extends internationally as well. So we can really help our global community in addressing global threats. Thank you.
Thank you. And then now on to Prof. Maleni. Apologies, I overclick. I just wanted to refer everyone to the fact that he has answered most of the questions in the Q&A if you need those. Then I wanted to now to go on to Dr. Pillay. Hang on a second, I'm just going according to the monitoring of outbreaks in terms of water, and then there was, and then Dr. Pillay. There's a question here for you. Is there scope to use sniffer dogs in terms of cross-border transmission? If so, is this option being pursued? They've been used successfully in many biosecurity controls, and there have been some reports of them being used in other countries for COVID-19. This could be a capacity developed for other zoonotic diseases and could be used beyond border control. And that's from Guy Preston.
Sorry, Debbie, who's that for?
Sorry, that is for Dr. Jürgen Pillay.
Ah, right. No, you know, there's ongoing research on the use of both rats and dogs to sniff out particular communicable diseases. And, you know, there was a review done certainly on rats in terms of their ability to sniff out TB. And you have to compare all these things to a gold standard. And the gold standard, you know, is unfortunately a lab test, whether it's a PCR test or it's the more recent antigen tests. So we've deferred to these lab tests because they have, you know, proven sensitivity and specificities in order to diagnose. And you would have seen, including on TV, that the National Health Laboratory Service had deployed lab personnel to the land borders and the airports to do antigen testing of people coming in and leaving. So we've deferred, the department has deferred to laboratory testing that have, you know, shown significant sensitivity and specificity. Over.
Okay, and then thank you very much for your answer. And then another question with regards to, I just want to understand, I'm not sure if this was explained in any way, how your organization, because I see on the program that you are the country director of Clinton Health Access Initiative. How does that fit into the larger framework? Were you working with the Department of Health?
Yes, yeah. So the Clinton Health Access Initiative has a memorandum of understanding with the Department of Health, and we are supporting the Department of Health on a range of health issues, everything from maternal and neonatal health through to TB and HIV and malaria. And of course, when the pandemic started in March last year, the department asked the Clinton Health Access Initiative to support the department's response. So we are supporting the national department together with a range of provinces in partnership with the Department of Health. Yes.
Thank you. I'm just trying to get questions from different people here. Ben Durham said, can Dr. Pillay comment on pooled testing and sewerage testing as a means of increasing surveillance? And that's Ben Durham from the DSI, Department of Science and Innovation.
Yes, let me start with pool testing. So we discussed with the National Health Laboratory Service last year, and we started that discussion around June, July, when the National Health Laboratory Service had a significant struggle in getting sufficient lab kits in, especially the PCR kits. So we started a process with a pilot in the Free State. And I know this because I was still with the department at that time. I was the Deputy Director General responsible for these programs at the time. So we engaged the NHLS to start a pilot to do pool testing. You can only do pool testing in a way that's reliable, both in terms of sensitivity and specificity, if the incidence levels are low. You get a significant number of false positives where the false negatives where the incidence is high. So pool testing can be used in instances where you have low incidence and you have a shortage of test kits. We stopped doing that because the incidence levels rose spectacularly in the first wave, and the pressure on companies to deliver test kits decreased substantially. So there was no shortage of test kits from about July, August onwards. So we didn't. In terms of the work that the Water Resource Institute is doing, it's highly commendable, the use of surveillance through sewage, because for sure we are not testing enough people, and we are clearly unable to test, obviously, those that are asymptomatic. So this is another way, and this is another approach to surveillance. As my colleague from the Water Research Institute said, some provinces have already integrated into the surveillance systems, like the Western Cape. And of course, we would support that, and I personally would support other provinces doing the same. Thanks, over.
Okay, and then there's another question for you, but I want to just remind people that in the Q&A on the answered section there is Prof. Maileni has given a lot of responses there. So just back to what might be the final question, unless someone has very urgently wants to ask something. It's from Everest. She says, this is for you, Dr. Pillay. What are the safety measures in terms of assessment on the efficacy of vaccines in phase 1 and 2 before getting to phase 3?
So that's a very good question, because as you know, the vaccine that's being rolled out now is the Johnson & Johnson vaccine. It has not been registered by the South African Health Products Authority yet. So the agreement with SAPRA and between SAPRA and the department and J&J, the manufacturers, was that this be treated as a 3B trial, which means that additional pharmacovigilance is being done, which means that data is being collected on each of the individuals being vaccinated to basically see if there are any additional side effects, and also to look at the issue of reinfections, whether there are any reinfections over a certain period of time. Now, the good news is that the FDA in the US has just yesterday approved the J&J vaccine for emergency use. So, we were the first country to use it in a 3B trial. The US has now approved it for emergency use as well. So, I think it's being done as safely as possible. As soon as I'm eligible, because I'm not patient-facing at the moment, I will certainly get the vaccine, because I think it has demonstrable safety. It's a safe vaccine, and it has demonstrable efficacy, including with the new variant we're finding in South Africa, the 501YV2. Over.
Thank you very much. And I'm looking at the time, and we definitely have time for another question or 2 more questions. There's just an anonymous attendee who asked, and I think this will come from Yancy, will there be any presentations today or tomorrow regarding animals specifically, as indicated in the theme for these 2 days?
No, it will be tomorrow. So we'll look at zoonoses as well as animal diseases tomorrow.
Thank you so much. And then there's a question from Edward Rubicki. I'm so sorry if I said your surname incorrectly. And this is for Dr. Wayne Ramkrishna. The One Health Forum is a wonderful concept, but some serious funding is needed to allow the kinds of surveillance and rapid responses that prevent outbreaks. Is this going to happen? Do you have any idea about that?
Yeah, thank you for that question. Yes, I think national governments and are under ever-increasing pressure to implement the One Health approach. I think through evidence we have seen that one sector alone cannot manage emerging infectious diseases, especially the zoonotic diseases. We've seen at a global level, there's a lot of collaboration going on where the WHO, the OIE, and FAO are working very, very closely together. And they are also encouraging national governments to do the same. So in the country, like I've presented, we are in the process of formalizing our One Health Forum and our One Health strategic committees and so on. And we're trying to formalize the way we work together, the way we share information and so on. So this formalization, we hope that will be materialized through the development and implementation of the One Health strategic framework. So this document has been drafted in consultation with the relevant stakeholders, including health, agriculture, environmental affairs, the academic institutions, and so on. So we have done that in consultation, and it's in the process, and it's going through the process of approval. So once that is completed, we hope will give us more, will give the One Health Forum more teeth, so to say, in terms of moving ahead with the One Health approach. Now, having said that, we're not waiting for the document to be finalized. In the meantime, we have coordination mechanisms already in place. We have consultations with the One Health stakeholders already in place, but the formalization would be important through policy. Thank you very much.
Yancy, is there time for another one or two questions?
Sorry, Debbie.
Is there time for?
Yes, there is.
Wonderful. Okay, Gordon Branston asked, and I think this is directed to Dr. Pillay again. He said, thank you for the important presentation with many lessons learned. Please comment on the resilience strategy required to urgently begin to refine or fit for purpose the COVID-19 pandemic experience to ensure the sustainable capacity. In other words, the capacity and resource scenario plans that would exist to address a much more virulent future pandemic in the short term. One which is highly contagious, where the infection rates are on a similar scale to measles or the Ebola variants. Thank you. That's from Gordon Branston.
Thanks very much, Gordon, for that. So, we are already planning a response to the third wave. So the Ministerial Advisory Committee has set up a technical working group, of which I'm a part, to look at 4 different areas in preparing, not for a future pandemic, but for a third wave, so that we ensure that we have significantly fewer cases and significantly fewer avoidable mortalities going into the third wave. So there's a work stream that's looking at trying to predict when we will see the third wave. So looking at modeling and epi-data. So there's a team looking at that. There's a team looking at clinical issues. Are we using the right drugs? Are we ventilating at the right times, etc.? So that we do at each level of the health system get the same outcomes in terms of case fatality rates, and that they are all lower than we've had in the second wave. In the second wave. The third is around communication. How can we improve communication, especially with regard to issues around vaccine hesitancy on the one side and decreased adherence to non-pharmaceutical interventions on the next side. And then the final one is the one I'm co-leading at the moment, is on the health system capacity. And that includes everything from surveillance and how to improve surveillance and using the different forms of surveillance, through to how do you prepare communities as well as health facilities to better respond. And that includes how much of funding do we need to put in place in preparation for the next wave in order to ensure that we have the right number of health workers, right number of beds, right number of ventilators, right volume of oxygen, etc., so that because going into a pandemic, besides the containment and the mitigation, you want to prevent the number of cases escalating quickly, and you want to prevent avoidable mortality. Those are the two critical things that you need to prevent. Over.
Thank you. I just want to point to people also in the answered questions that Mr. J. Bhagwan from the WRC, from the Water Research Council, has also answered two important questions, which is why I'm not coming through them. I'm not speaking about them now. And here's a last, final, short, quick question from Everest Umbatsumbu. It's again for Dr. Pillay, very popular man. In the slide of government interventions on vaccine, what is the difference in time between the different phases?
So I think it's now well known that the phases will depend on the access to the vaccines. And the more rapidly the government is able to get large quantities of vaccines in, the sooner the government would be able to announce the start of the second and, of course, the third phase. So the anticipation at the moment, and again, this is a variable that depends on forces outside of South Africa. It depends on manufacturers and the extent to which manufacturers can bring their products in large volumes to the market. The expectation is that the second phase can start as early as mid-April or early May. But that depends entirely on the availability of large quantities of the vaccine being available.
Then let me go through just in terms of, I just think it's interesting because two of the speakers, in terms of indigenous knowledge systems, that was Prof. Maleni and, from the Water Research Council, Mr. J. Bhagwan, they predominantly answered in the Q&A. Now, just to highlight to people, Everest asked a question with regards to just generally how far research has come along with specific medications or items that are used within African herbal medicine to treat HIV hypoxia and Sutherlandia. It's a very long question, so I'd suggest she basically says how far has research come. And Prof answered, what we lack are clinical trials and quality products registered by relevant authorities in the SADC region. West Africa is doing far better in this regard, with some of their products listed in the essential medicines list. I guess we will get there sooner now that the World Health Organization is coordinating. Then Gordon Branson asked, thank you for your contribution to highlighting the critical relevance of indigenous knowledge systems and traditional medicines within the context of future emergency planning and preparedness for future epidemics and pandemics. Can you comment on the importance of coordination and roles with all relevant structures and the most effective strategy to bring this goal to fruition, such as legislative requirements at a pan-African, regional and local level? Or potentially with strategic sustainable development context. After all, what would be the result of not pursuing this indigenous knowledge system / traditional medicine objective? And Prof said, I think the AU would be the best place to guide at the continental level. But the fundamental is the acknowledgement that indigenous knowledge is integral and included in the policy and programmatic responses. Apparently lunch did something to my head. Is integral and included in the policy and programmatic responses. What dominates becomes the biomedical thinking. So it appears to me that Prof was responding by saying we need to get the basics first before even looking at the larger context of future emergency planning. Our anonymous attendee asked when it comes to education and training with regard to traditional healers, were there any scientific or technical aspects of the pandemic or treatment that were difficult in terms of understanding or being accepted by the traditional healers? And Prof said, communication of these diseases is largely in English, which requires to be translated into local languages. We find some of the words non-existent, but working together, we develop them. That's interesting. Once that is done, it becomes easier to move forward from a common standpoint. And then Evarista noted, and Prof agreed with her, that the promotion of traditional medicine research output by the government is needed by the government and other academic institutions so that it is used on a national level. And then from the, are we okay? Do you want to, should I continue?
Yes, continue a little bit.
Okay, we're still poll in progress. And Every said, in this case, she was speaking with regards to the Water Research Commission, Mr. J. Bhagwan, and she said she found it very interesting. She'd love your answer to show slide 19 and 20 again. And I suppose this is a point to say that the video and the slides will be on the NSTF website under discussion forums, under past discussion forums, and these appear, the presentations usually take a day or so, if not immediately, and the video then takes a little longer, and then a condensed version of the, through a media release of the central themes appears within around a week. And how long does it take for a full summary, which is basically a word for word, Yanzi?
About 3 weeks.
About 3 weeks. Okay, so everything will be there. So people could have been in, so she asks here with regards to slide 1920, people could have been infected by COVID-19 as you successfully recovered the virus from waters in Gauteng, KZN, and Western Cape. What are the current treatment measures of water to prevent the public to exposure? And Mr. Bhagwan responds, the report with the graph is available in the report on our website. The conclusion is that we can detect the RNA signal. It is possible to do quantification once we establish the viral loads in individuals. This then can lead to heat maps and early warning. At present, the increase in amplification CT against the clinical data tells us that there is a relationship. The quantification will help us also identify the asymptomatic cases. Disinfection of water supply offers a good barrier in drinking water systems. We have found no live viruses in the general water environment as yet. Good sanitation and hygiene is the most immediate measure are the most immediate measures required to prevent exposure. And I want to just draw a point there from a communication perspective. It's interesting how the media got that information incorrect around what was actually in the water, that it was not live virus, and they said there was a live virus. Okay, Gordon Branston also asked from the Water Research Commission from Mr. J. Bhagwan. He said, thank you for your insightful and innovative strategy as an important public health tool. Please can you share your thoughts on how best to upscale investment in a permanent national wastewater-based epidemiology, a WBE network. I wonder what WBE stands for, which could then prove economically viable or vital in preparing for faster and more effective control of the inevitable next pandemic. In the future, wastewater monitoring epidemiology will play a key role in revealing health disparities and the many vulnerabilities among communities by universal monitoring for biomarkers of non-contagious diseases, which is a key issue for public health in the years to come. And Jay answers, my views on this is that there is a weakness in capacity at the municipal level in terms of environmental health monitoring. Too much bias on engineering. The Department of Health must provide leadership and investment, as well as drive policy and regulations to ensure greater uptake. Big industry is already harnessing this opportunity for its staff and immediate communities. And that covers the questions that had been answered in the Q&A space.
Okay, Debbie, thank you very much. Interesting questions and answers there. We will download the chat as well and take it into account for the summaries. 2/3 of the people have voted. I'm going to end the polling now because I think the trends are clear. Just share the results. 57% of us say yes in many ways. Has any good come from our experiences with the COVID-19 pandemic? And 57% are really give an optimistic answer. Secondly, 30% say mainly in public health, by which I understand that there haven't been enough lessons or enough good that has come outside of the public health sphere. And then 22% said in a very limited way. So thank you very much for your answers. I've got another poll which I will share at our question and answer session after the presentations. So with that, we come to Professor Sheetal Silal. She is Director of the Modeling and Simulation Hub, Africa, University of Cape Town. And this is a fascinating talk for me because I come from a maths background, and I really am so pleased that mathematics is coming into its own, or appreciation of maths is now much greater because of the pandemic.